So it is the 20th of October in the year of 2020, which is one that's going to go down in history for sure. We currently have 4,266 cases. We now have 60 deaths in Ingham County. We are back down to 3 hospitalizations in Ingham County rather than 1 in the ICU. Some of that is because we lost some of the people that were hospitalized last week. We have 934 active cases, home outpatient, and 3,269 recovered. Still looking at a case fatality rate that calculates at 1.4%. And again, the monitoring has to do with all of the contact tracing related to people who have been in close contacts with case, either by our own department or by the state Trace Force team as a contract that they have with them. So when we look at our hospitalizations of Ingham County residents, you can see that we did have a significant surge in hospitalizations that is going back down. Again, like I said, we did lose a few people that were in the hospital, so that is part of that. I do have, though, a slide here from Sparrow Health System, which I think is very helpful and informative, and they gave me permission to use it. So this is the COVID census, as they call it in the hospital. So when they talk about hospital census, that's patients occupying their hospitals. When they get to capacity, that means they're reaching their census count. So this is their census with COVID patients. So this is not just Ingham County residents, but any hospitalizations in Sparrow Hospital. So what we're looking at is the trend over the entire period of the pandemic. And I have placed in here for you a couple of arrows and a couple of, little symbols here. So right here was when we saw our peak in cases, when we had an outbreak in late June, early July. So the peak was right about here. And then we saw hospitalizations this period of time later that increased like this. They did go back down, kind of hopping around a little bit. This is the peak we saw in September, which was a significant peak compared to the one we saw in June. You'll see that on my next graph. And here is where we are now following this peak in cases, these hospitalizations. So again, increased transmission in the community here, as well as here. Eventually the delayed indicator of this spike in hospitalizations, both here and here. So we are basically 21.9% active cases, 76.6% recovered, 1.4% deceased. And this is our cumulative count. We are not flattening at this point in time, still working on that. But as you know, I don't have to tell you, this has been a surge in cases across the state, across the country, even in Europe. So I think we probably could safely say that despite the fact that it's been hard to determine where we are in waves here, that we probably are entering that second wave at this point in time, or are partway through that second wave. So this is our Ingham County incidence curve. And this is where I was telling you those peaks. So this is the peak in cases that we saw in late June. And this is the peak in cases that we saw in September. And if you think back to that graph, those peaks were followed then by the peak in hospitalizations weeks later. Whoops. When we look at our positivity rates, we still are hovering a little closer to the 5% range. Ideally, we would be under 3%. So, but we aren't, in an incredibly danger zone. But we would like to see that number drop down below 3% again, which is where we were during this period of time in here. So, rolling averages for both of those. So, positivity in the blue line and cases in both in rolling averages in the bars. So you can see the peak that we had here, and then this just continues to kind of bounce around. Because these are 7-day rolling averages, and because reported cases can sometimes get placed in dates prior to it, sometimes we'll see this little downward trend, and then I might come to you next week and you'll see that continued to go up. So as that 7-day rolling average comes in and new cases get put into onset date, that those downward trends sometimes can turn back up. But we are seeing a downward trend in percent positivity once again. So if you look at cases by zip code, we're now at a little over 1,700 cases in 48823, followed by 550-ish in 48911, and then followed by 48910, 48912. As you can see, we start dropping below 100 down in the 48895 and 48825 range. 48825 would actually be Michigan State University. So looking at those cases by rate, certainly as is obvious in the significant difference in case numbers, even when you adjust for population, the rate in the East Lansing zip code is significantly higher than that in any of the others, followed by 48911, and then there's another one there. I promised I would learn my zip codes, and I did look at them, but I'm forgetting. That might be 48915. And then this is 48906, which is towards the airport, Hazlitt, and then these in here, all in that 778 to 1,000 range in terms of their shading. Remember, this is rate, so it is basically the number of cases per 100,000 population. When we look at our heat map now, we can clearly see, that, what is it now, 3-4 times the number of cases in the 48823 zip code compared to the next most prevalent zip code. And, just continuing to narrow in on that. Again, I'll remind you that we were looking at some fairly dense yellow spots all through 48911 until the case counts in 48823 basically kind of create a separation of those so they don't look quite as intense anymore. The number of cases, however, hasn't changed. So this is 48823. And, I think what we're seeing here, we had some pretty good margins around these yellow areas here, but here you're seeing this start to grow out in this area. We're starting to see some spots pop up here, up in this area. So we are continuing to see spread in the 48823 zip code. 50% of our cases are male, 50% female. When we look by age group, we are less at 2% 0 to 9, our two predominant age groups, as we've been discussing, and I didn't do the 18 to 24 breakout for you. Again, it's pretty much the same as it was last week. So 20% of our cases are 10 to 19. The vast majority of those are 18 and 19. 41% of our cases are 20 to 29. The vast majority of those are actually 20 to 24. So then we follow with our age groups 30, 40s, 50s, around 8-9%, and start dropping off from there. When we look at our cases by race, 67% are Caucasian, 14% Black or African American, 6% Asian, and 11% other. So again, when we calculate that by rate, we do have a disparity between our Caucasian, our African American, and a very slight one between our Caucasians and Asians as well. When we look at cases by ethnicity, 83.1% are not Hispanic or Latino, 8.2% are Hispanic or Latino, and 8.7% unknown. And then that rate also shows a slight disparity between our non-Hispanic or Latino population, which has a lower rate, despite a higher percentage of cases than our Hispanic and Latino population. When we look at our deaths, also demographically by age, 1.7% 40 to 49, 6.7% 50 to 59, 11.7% 60 to 69, 33.3% 70 to 79, and 46.7% over the age of 80. So as you can see, the vast majority of deaths are in the 70 and over, and then increasingly in the 80 and over age group. The breakdown by sex is 48.3% female and 51.7% male. And when we look by race, we are 68.3% Caucasian, 25% African American, 1.7% Asian, 1.7% unknown, and 3.3% other. And then by ethnicity, 90% are not Hispanic or Latino, with 5% Hispanic or Latino and 5% unknown. We're going to look at this MSU data again, but this outbreak is kind of trailing off on us, so we might not focus on this data anymore, but we can always refer you to the weekly case counts that they are putting on the MSU dashboard and can continue to do those. But as these numbers tend to trend down, are trending down, then I think we can quit going through these graphs, all of these graphs on a regular basis. But you can see, again, the significant surge in cases in September was largely, going on in the MSU and 48823 zip code. So MSU related 48823, which is why we saw that incredible surge in cases as well in that zip code. Those case counts dropped off and have continued to drop off. When we look at percent positivity, that too is dropping off. I will tell you that this little blip down in here, we did have a couple of days where there was no testing, and so there was 0%. And then we had some days where there were very low numbers of testing. So, 0 out of 10 or 15 also results in 0%. So we'd still like to see increases in testing, but really increases in testing across the board, especially in areas like 48823, where we see a high level of transmission. But even the county level percent positivity is starting to drop off, which would not be happening if this percent positivity were still trending upwards. So we are seeing that percent positivity trend downwards at this point in time. And here you can see both of those on a rolling average. So this did drop down to 0, but again, that was because of a couple of testing days that were fairly slow. When we look at cases by week, and this is the graph that you will see on the MSU dashboard website, whatever they call it, I think it's at Together We Will. You can find their dashboard. So we did peak in cases the week of September 7th with a significant number of cases on the weeks on either side of it, and then started trending down and leveling off from there. The numbers do change as we go into the next week because, there are times when we will identify a case and then identify an onset date that might have been prior to October 12th, even though we're just getting results on the case and getting a hold of somebody to do a case investigation at this point in time. So that is where we are with MSU cases. Then basically, if we take that cumulative case count in MSU related cases and our county cases, you can see that we have leveled off here, but this trend that went up here continues to be driven community-wide, as basically, increased transmission in a community will eventually start to impact the community across the board, as well as hospitalizations and eventually deaths. So that is indeed what we're seeing. And that is my slideshow for the day.
Thank you, Linda. I do have a question from Mark Bayshore. He says, Michigan's House Republicans have come up with a coronavirus response proposal that would give county health officers authority to localize responses to the virus. They say it would give you leeway to set looser standards than state standards if the county is within particular benchmarks and avoid a one-size-fits-all approach. Have you learned about the plan, and if so, what do you think of it?
Right now, all I have is pretty much a summary, as well as having seen the press release, as all of you did. So, I can say a lot about it. One is the plan looks as if, hey, we're going to start using science and metrics to do this. We've always been using science and metrics and thresholds to make these decisions. Cases don't conveniently stop at county lines. Borders of geography, and some health departments have multiple counties within even their health department jurisdiction. District Health Department 10, for example, has got 10 counties. Places like Ingham County, for example, our major city rests in 3 different counties. So we also have created a MyStart map, which has metrics. Many of the same metrics that you see in this plan already exist, with thresholds that put us into low, medium high, et cetera, risk levels. And so this isn't new, it's just a change in all of them. I don't see anything except for one benchmark as opposed to a graduation of benchmarks. It's not an all or nothing proposition. When we talk about hospitalizations and bed capacity, that sometimes is not an easy thing for all health officers to have that information. PPE supplies for our local hospitals can change very rapidly and increases the need to constantly be looking at those metrics with them rather than the state tracking those metrics for us. And testing capacity really is set fairly low. So yes, it does say that if we meet these metrics or data points, for example, 55 cases per million or below a 5% positivity, I've told you already, we're a whole lot more comfortable at 3%, that the county health director, health officer, as they call us, has the ability to modify the restrictions if we choose. I think that creates a lot of, first of all, I will tell you that my colleagues were not involved in this, to my knowledge. I haven't talked to any of them yet, and there have been exchanges on our emails today about the fact that we didn't know anything about this. So I don't know what health or public health experts were involved in providing feedback, but it was not your 45 local health officers in the state of Michigan, nor our statewide association. And I have deep concerns over basically, what we asked for when the governor's executive orders were voted, by the Supreme Court to be unconstitutional based on the law that they were based on being declared unconstitutional. What we asked for was exactly the opposite, for the state to put into place a statewide plan, statewide orders, statewide, capacity restrictions, et cetera, so that it didn't become piecemeal, county by county, jurisdiction by jurisdiction, health department by health department. So now you're looking at exactly the opposite of what your local health experts asked for, coming out from our legislature. I haven't seen the full plan, nor do I really know at this point in time what kind of information or who was involved in discussing or providing the science to go behind this. So I don't have any information other than that, other than knowing it exists, knowing that we weren't involved in any discussions to my knowledge at this point in time. If a health officer chimes in and says, yes, they got a hold of me and I talked to them, I will be happy to recant that. But at this point in time, I have not heard from a single one of my colleagues that had any knowledge about this before it came out this morning. It is deeply concerning in a lot of ways. I think it has the potential to, I'll just stop there for now because I'm guessing we're going to get some more questions on that one.
All right, Kyle Kaminsky, go ahead, please.
Hi, Linda. I saw the Washtenaw County Health Department issued a stay-in-place order for U of M students. I'm wondering if you feel inspired by that.
U of M is if we go back to looking at that graph at MSU, we don't have the data to support a shelter-in-place order for MSU students right now. That our ship sailed on that one when we peaked in cases in September at MSU, and now we're trailing off. So they're behind us at U of M. They did have some of the same complexities that we did at the time that we chose not to do a shelter-in-place order while GVSU did. And that is the number of professional colleges and graduate students and those sorts of things that are kind of a little bit different of a demographic. So you'll notice that U of M order is for undergraduate students only. The other huge difference is they do have on campus as well as off campus housing. They have students on campus, they have classes on campus. So, that was certainly, and we talked about that being on the table if MSU cases did not get under control. but we are certainly not at a point right now where data would support a shelter-in-place order for MSU students when you look at the case trends in MSU-related cases right now.
Thank you.
Go ahead, Eric Lacy.
Yeah, thanks, Linda. I wanted to ask regarding the stay-at-home order in Washtenaw County. Do you think the MSU, even though there won't be fans in the stadium, there'll still be, it's a Halloween, there'll probably be a lot of MSU fans, students that may want to party in Ann Arbor that day. I guess, what are your thoughts of actually playing the game, and, you know, what do you make of it kind of in relation to that, where things should go from here?
I'm going to guess that's going to be really challenging. I certainly would expect it to be challenging here. You know, there are a number of exceptions for people related to the shelter in place, which there always have to be. And that oftentimes makes it very leaky because, you know, how do you identify somebody who is sheltering in place but has gone out for the exception of I have to go buy food or I have a job or whatever. And then so then they're out and about. It's hard to identify who's doing what and why. So I would expect that there certainly will be some challenges relative to the game day coming up next weekend when the shelter in place order will still be in place. The games themselves with the Big Ten are only allowing participation in the stadium to the extent of, I think it's a couple of tickets per player. So we don't anticipate in Spartan Stadium any more than 200-300 people in the stadium for a game. And it would be the same at U of M. So the inside the stadium issue is not as significant as outside, and that's exactly what you're driving at. Is, you know, you've got a shelter-in-place order at the same time that you have an upcoming, you know, Halloween evening game, MSU versus U of M. So, and that will be in Ann Arbor. So I certainly didn't answer your question. I just kind of, you know, echo your sentiments that that's going to be quite a challenge, and they're going to have to do the best they can down there. And, you know, we are, you know, working on messaging here and have been that, you know, we're trying to get people to stay at home to watch games, not travel to go to games, not go out and do watch parties, large gatherings, that sort of thing for games. So basically, games at home are your most advisable thing to do at this point in time.
Gotcha. Thank you.
Or watching the game at home, I should say.
Yeah.
Go ahead, Craig.
Yep. I know back a few weeks ago, we talked about the prospect of community spread having an impact on your desire to let the football games continue. I mean, I know the numbers are trending down at MSU, but what's your perspective now on the potential for community spread and how that may affect your willingness to let these events continue?
Well, our numbers are down right now. So I actually reached out to all of my Big Ten chief health official colleagues and had a meeting with them last week to talk about asking the Big Ten to set metrics for communities as well as their teams for when gameplay was advisable versus not advisable. And I can tell you that those metrics, even amongst my colleagues, would be significantly higher than where we stand right now. But the problem is going to be is that people are going to gather, most likely indoors. It looks like it's going to be cold on Saturday. So you're going to have a lot of indoor gatherings, which could result in another spike in transmission as we move forward. And then we might be looking at additional restrictions depending on how that goes. So we are working on, as the health officials for the cities and counties of the 14 Big Ten schools, a request of the Big Ten to not only, if you've seen their plan, it's if they're testing positivity, which is all tests, so people might get more than one test, total tests, total positives exceeds 5%, and if their team congregate population, so their population metric in there is not a community population metric, it's their team congregate population. If the individuals testing positive relative to the total team congregate population exceeds 7.5%, then they are to discontinue practice and discontinue gameplay for a week. The plan that I saw from the Big Ten then goes on to mention that the relative spread or metrics in the community might also be relevant to the decision making. And so they're going to put those numbers on the dashboard. But unlike a threshold, a clear go, no go that they establish with the team and the team congregate population, they don't set a metric. And honestly, from the perspective of a health official that might have to look at how dangerous it might be to play a game in a town and know how popular Big Ten football is, college football in general, and how unpopular it would be to call one off, or to recommend that one be called off, I should say. I don't know that we have the authority to just flat out call them off, because it's going to have to be based on gathering size. Anyway, we would like them to set that benchmark so that basically, the Big Ten has established if a community, if a locale that this game is to be played in exceeds these metrics, then that game can't be played in that community.
Next, we have Ben Henry.
Hi, Linda. So just going beyond going beyond October, and about a month from now is Thanksgiving, and then we have Christmas and New Year's. There's been some guidance from the CDC that says people might want to consider not gathering this year. I'm just curious what you make of the guidance and if you would have any advice on people who are thinking about gathering for Thanksgiving, because I know a lot of the part of the increase is attributed to small gatherings.
Yeah, I mean, a lot of the issues regarding transmission really do have to do with gatherings. I mean, if we're all pretty much staying at home and we're only interacting with our household members, and when we go out and about, we have all of these, mitigation measures in place, masks and that sort of thing, as we go into stores and restaurants and those sorts of things, then we've mitigated a lot of risk. It's when people gather, especially in private residences and other places where there aren't people there to watch, and you see, parties that, 50 or 100 people or whatever inside, large houses or things like that. And that is a very risky thing to do. So I think, I haven't seen the CDC guidance. I did see the MDHHS guidance about Halloween, but, I think we talked earlier about the fact that as we approach the holidays, certainly, typically between Thanksgiving and Christmas, you see a lot of people throwing parties. That's the typical time of year that we all have a hard time finding. It's like, when am I available to schedule this party kind of thing, because there tend to be so many gatherings. And so what I would say is, again, the gathering limit for residences is 10 indoors. If you are having a gathering indoors that is outside of your household with that limited 10 people, it is still advisable to wear a mask and maintain that 6 foot of social distancing, because you are with people who are not from your household. So certainly, families, can have some small gatherings. I wouldn't, want people to be disconnected completely from their loved ones Thanksgiving and Christmas. I might go see my grandchildren, but that'd be about it. Me and my partner, Mike, and my daughter and her husband and my grandchildren, safely interacting in a very small, just, way. So I would say that, yes, large gatherings, parties, socializing, having to have office parties, those sorts of things, bad idea. Spend some time with your immediate family. If you're my age, your children, your grandchildren, that sort of thing. Not completely, off the table, but certainly something that still needs to be done safely. And if those numbers start to creep up towards 10, you certainly need to also be cognizant of the other things that are in place to help mitigate the risk of spread. So you might want to be, wearing a mask, and you might want to be finding ways to have tables that, allow people to space out, or, the adult table and the kids table, have, multiple tables, that sort of thing. So I think there is definitely a need to mitigate risk even in smaller gatherings, and certainly larger gatherings and parties are not advisable.
Next, we have Robin Erb.
That's uncool, Ben. That was my question.
Well, there we go. It's already answered.
Actually, I do have another couple of questions on. I'm really struck by what you said earlier, that this plan today didn't have public health input, as far as you know.
As far as I know,
You
not at the
mentioned-
level of my colleagues. I don't know where the advice would have come from. Nobody's
you mentioned-
disclosed that to us at this point in time. So.
Okay, you mentioned that you had some email conversation. I guess I'm just trying to figure out, I mean, do you feel like have you talked to several people? Could you just talk to me a little more about how
It's the leadership of our association. So our association is Michigan Association for Local Public Health. The board of that association is the health officers from every county in this state. So it's a 45-member board. It actually has a couple of representatives from forums as well, like Amanda is from the health educator, I think the health educators forum or something like that. So we do have some representatives from some other groups on that board as well. Then we have an executive committee, which I'm part of. So the executive committee is a president-elect, a past president, a treasurer, and then some at-large members. So it's a fairly sizable group of us, maybe 10 or so. Amongst the 10 of us, so far, none of us had any knowledge of it.
So you have talked to the other 9 members or emailed or whatever, and none of the executive committee was consulted.
Not everybody has chimed in, so I will say that, but I have not seen that. I talked to somebody from the Michigan Association of Counties today, and they also weren't necessarily sure what had happened in terms of who was involved. They were reaching out to us to ask us if we had known anything about it, if we were involved, and so far the answer to that has been no. It's very highly unlikely, I will tell you, that one of my colleagues on my executive committee had meetings to help develop this plan and didn't tell any of the rest of us, because there's an extreme amount of sharing. There's been a lot of work that has happened over the last several months, even when the governor has issued executive orders. Sometimes some of my colleagues feeling like, why didn't we have any input in that? Honestly, when you're writing orders in the midst of a really urgent situation, sometimes you don't have time for that. And what I have found is that once the governor releases an order, if I have questions or concerns or think it needs to be clarified, I have easy avenues to send that up to the governor's office, and I see changes as a result of it. So as the orders have switched over to where MDHHS is writing them as epidemic orders, they have pulled in representatives from local public health to work with them in actually creating those orders. So we have a voice in those. So while we fought to have a voice in those, and our current president, who just took place of our president who just became our immediate past president, is actually on that group and working with Michigan Department of Health and Human Services related to orders that are coming out from Michigan Department of Health and Human Services. When I don't hear from that president that he was also involved in a discussion with the legislature about this plan, then I pretty seriously doubt that he was.
Can I ask you something totally different?
Sure.
Since again, Ben messed me all up. Flu. I know there's a push to get boost the flu vaccines. I happened to be getting mine last night, and somebody in front of me told me they had trouble finding one, that they had gone to a couple of providers and were out. But I'm right on the Ohio line, so it may have been an Ohio thing. I'm just curious, how are your flu vaccines holding up there? And can you talk to me a little bit about that?
I talked to my immunizations coordinator, and I think it was the high dose vaccine that is for the older population. So I forget what age. I think maybe it's 65. Sorry, I don't have my immunization information in front of me. But there's a high dose vaccine, and I think there was a little bit of a delay in that. We are doing fine right now. I haven't heard any problems in this county in terms of vaccine. So. Maybe it's a good sign that more people are getting flu vaccines this year, which would be great news.
Great. Thank you.
Brittany Flower.
I just will add to that we have had sometimes they refer to them as shortages. A lot of times it's just what you call a delay. I don't know, semantics probably. You know, the vaccine is there, it's coming out, there's just a delay. And we've seen that before. And the system, I've never seen the system not be able to catch up and basically deliver the vaccine that we need to be able to vaccinate the population that we have. I mean, you look at, you know, what happened when we had H1N1 and the, you know, the doses of vaccine that came out readily. So we know that if we start to run low on vaccine, that the vaccine manufacturers can come through and deliver us more vaccine. Sometimes it just causes a little bit of a delay.
Great, thank you.
Okay, next we have Brittany Flowers. Go ahead, Brittany.
Hi, Linda. I want to circle back to hospitalizations at Sparrow. I kind of have a two-part question. I know the past kind of month and a half, you've said on several occasions you're concerned about hospitalizations we'll see in October and November based off of cases that were happening in East Lansing at that time. Do you think that is a result of those cases? And based on numbers where they are now, do you see those hospitalizations continuing to rise or falling back down?
First of all, let's not directly connect them or directly blame, right? So did, you know, the MSU cases give it to somebody who now we can directly connect them together and now those people are hospitalized? Usually it's another few transmissions down the road, which is why it's a delayed indicator, which is why I keep saying that what really was the problem was the incredible level of transmission in this community. We reached 320 cases per million per day. The safe benchmark that the House of Representatives just put out for us to discontinue abiding by if the health officer decides to, the MDHHS orders, is 55. Now let me say that again, we were at 320. Even this House plan says at 55, you can consider basically, you know, what as a health officer you might do regarding the MDHHS orders. So that was an incredible level of transmission in the community. The number of cases is just an indicator of overall just transmission going on in the community. When that happens, we know that eventually the people who are most vulnerable will eventually get exposed as well, and hospitalizations will go up and deaths will go up. So it's kind of an indirect connection. That's why we call it a delayed indicator. You know, when you see one, down the road comes the others. And time again, that has shown to be true. In every state, in every country, you know, you're looking at, you know, I just showed you our peak in June, July, followed by somewhat of a peak in hospitalizations that followed that by a few weeks. And then where we are now relative to the transmission that we had in September. And of course, you know, the magnitude of hospitalizations now relative to the magnitude of hospitalizations back in June and July also kind of match, because we had a peak back in late June, early July, which right now looks really small compared to what happened in September. So likewise, that little spike in hospitalizations back shortly after the June, July peak in cases was a much smaller peak in hospitalizations than what we're seeing right now. So what Sparrow is showing us right now, and I did get permission for them to show that slide, although I added the arrows and the booms myself. That basically tells us that level of transmission leads to an even higher level of hospitalizations. We're looking at hospitalizations levels that are similar to what we saw back in April, which was when we were struggling to really make sure that we didn't exceed capacity of our hospitals. So that's kind of where we are right now, is getting once again concerned that we don't exceed the capacity of our hospital systems to take care of people. Keep in mind, you know, even though we're up to 60 deaths now, you've seen the level to which new deaths are occurring in this country gradually drop. Part of that is because cases drop, but part of it is because just like all of us public health folks had to learn this virus and figure out what to do with it. And it's like, you know, it's like, okay, we should be doing this. And it's like, no, we should be doing this instead. It was a new virus. We had to figure it out. And we're still figuring it out. And it's not because we know what we're doing. It's, you know, it's science. Science is an iterative process where you learn and you continue to learn and you continue to tweak in order to do things more correctly. So the healthcare system has done the same thing. And early treatment of COVID was the best treatment they knew how to provide at the time based on what they knew they were seeing. Their experience with COVID over the last several months has changed their treatment regimes to a certain extent, to where, once somebody becomes seriously ill and becomes hospitalized, they are generally less likely to die than they would have been back in April. So with that caveat, though, if we exceed the capacity of our health systems to take care of those people who become very ill, then we will see basically deaths that didn't need to happen again, because we just simply do not have the healthcare system capacity to take care of the number of people that become seriously ill. So that's what we're concerned about, once again, is not exceeding that capacity, so our healthcare system can continue to do really good work that they're doing at, keeping this death rate from continuing to skyrocket, but we need them to be able to do their work.
Thank you.
Next, we have Dave Ackerley. Go ahead, Dave.
Hi, Linda. A conversation today on air with Dr. Samuel Stanley, MSU president. You obviously know his medical background. We talked about the latest number, the 1,600 plus MSU related cases. It was his contention that these cases were primarily student to student and didn't result in the kind of community spread that would spike hospital numbers even after tracing contact, et cetera. He even said at some point he would expect that it would have been worse here locally than what we did see in the hospital. Do you agree with that? And are you of the same mindset that this ended up being, from the highest end a month ago, primarily student to student?
It was primarily student to student in the month of September, without a doubt. So when you look at the number of cases and the percent of cases that were 18 to 24 and the percent of our overall cases during that time that were basically MSU related, certainly. Did that eventually start to affect the community? Yes, unfortunately it did. So again, it's, that student to student, but then eventually those students are in workplaces, they're with family members, they're at birthday parties, they're at funerals, they're at weddings, those sorts of things. And so, I'll just say that, I calculated the numbers. I excluded all of the MSU cases from the 48823 numbers. I don't have a calculation for October as of right now, but when I looked at August compared to September, we had a 125% increase in cases in 48823 unrelated to MSU between August and September.
Okay, so in other words, maybe it takes a little bit longer, or I tried to get him to clarify today, but he was pretty convinced that of what we've seen so far, that there's been very little. He said I think he said no hospitalization of MSU students, or so small to be insignificant, and not any spread out from that student community to others that resulted in hospitalization. And you're saying that may not be accurate?
I'm not sure that that's accurate. I will say that the primary, transmission that was going on in September was student to student. Did it eventually get out of that? Yes. Can we track that exactly where it was? No, because we have just this high level of community transmission. Were MSU students hospitalized? No, though some of them did go to the ER, which does get put into the hospitalization. They just don't get admitted and come back out, and they don't have a admit and release date. But we are looking at hospitalizations right now. I just showed you the spiral graph. So those are numbers. That's data. I don't know how to tell you anything differently other than we have a serious surge in hospitalizations. We're seeing an increase in deaths. We saw a huge increase in cases, which are going down. But if you look at the huge spike that went down, we're now kind of on more of a gentle roll, sort of back up again. And that probably is more related to the community around MSU rather than MSU directly. And when I say community around MSU, that's 48823. It's the rest of the county. It's the county in general. It could be Clinton County. It's, we're seeing a surge of cases nationwide. We're seeing a surge of cases in Europe as well. And most sources have said that, you know, we had a lot of cases in our 18 to 24-year-old age group that happened in that August-September range. Those are facts. So, you know, tying all those things together just requires you to, you know, interpret things. And, you know, he's an infectious disease physician, so, you know, I respect him tremendously. But I don't know if he has, I'm sure he does probably have access to somebody at Sparrow who gives him hospital numbers. We do know that those are up, and we do know that cases are starting to increase in the community at large.
All right, thank you.
At this time, there are no questions in the queue. If you have a question for Health Officer Linda Vail, please go ahead.
I will just add to that as well, Dave. You know, it's kind of, you know, things just cloud things. It was like I was saying before, it's like, are we in a second wave? It's kind of hard to tell because of what just happened. You know, so you've got the MSU cases go up and down, and you also have probably what's a second wave of this virus coming along. Did those two things probably collude together to some extent? I would say likely so. But, you know, there is independently also just a surge of cases nationwide, which we're all seeing. But we are seeing a lot of cases in university and college towns as well. So.
Yeah, and let's be clear, I wasn't trying to pit you against him, but I wanted to indicate that there might be, he had a slightly different point of view on that and maybe wasn't as convinced that any hospital numbers here that did happen were directly tied or from a second, third contact to MSU. And he was even surprised. He said, I really thought that it would have been even higher based on the total case numbers that they saw. He said, I'm happy it's not, but it was an interesting counterpoint. That's all.
Right. So, I mean, he is correct that we didn't have any MSU students hospitalized. To my knowledge, there were no secondary cases that we directly connected to an MSU student that was hospitalized. It's the community transmission that did indeed increase. We lost control of this virus in September.
Thanks.
Go ahead, Ben.
Linda, I'm just curious as to get your reaction about the president's comments about how we've had enough of the virus and calling his own health experts idiots. Do you have any reaction to that?
Well, he called us all idiots, actually. He referred to public health officials as idiots. So I took that as basically having been called an idiot myself. I think he referred to Dr. Fauci as a disaster that's been around for like 500 years or something like that. You know, I don't like to get into politics too much because I have a job that is better off if I stay out of politics. It's been very, very hard to deal with this virus and not also deal with the politics around it. Science is not opinion, it's fact. You know, metrics are metrics, they're not made up. And there's a lot of expertise in this country. And Dr. Fauci is a prominent expert and has been for years, for decades. You know, he gained the trust of the HIV community for his work there as well. And to dismiss Dr. Fauci is one thing, but to dismiss and call basically all public health officials idiots is kind of scary, because we, you know, the federal government is not responding in each of our communities. We are. And it takes us and our ability to be experts in what we are to be able to do that and to protect our communities. So I don't think you can take a broad brush and say that we're all idiots because you don't happen to agree with some of the things that the science that we look at says are true.